When we first started our vaccination program, there were real questions how quickly we could get shots in people's arms. Well, by the end of May, the vast majority of adult Americans will have gotten at least their first shot. That's success. That success is going to save lives and get this country back to normal sooner. But it's not enough. On March the 11th, I announced that I was opening up all vaccination sites to all adults by May 1st. Many governors, Democrats and Republicans, responded and decided to beat that date, which was good. Thanks to their hard work and the hard work of the American people and the hard work of my team, I'm announcing today that we're moving that date up from May 1st to April 19th nationwide. That means by no later than April 19th, in every part of this country, every adult over the age of 18 or older will be eligible to be vaccinated. No more confusing rules. No more confusing restrictions. My message today is a simple one. Many states have already opened up to all adults. But beginning April 19th, every adult in every state, every adult in this country is eligible to get in line to get a COVID vaccination. And today, in advance of that new national full eligibility date, I want to make a direct appeal to our seniors and everyone who cares about them. While we have made incredible progress vaccinating 3/4 of our seniors and putting vaccination sites within 5 miles of 90% of the public, it still isn't enough. It's simple. Seniors, it's time for you to get vaccinated now. Get vaccinated now. To make it easier, my administration is sending aid to community groups to drive seniors to vaccination sites. We're incredibly grateful to all the volunteers, houses of worship, and civic groups that are helping us in this effort. This is America. We take care of one another. We have to keep it up. As I ask seniors to sign up for their shots now, I also have a message for people under 65. If you know someone over 65 who has not gotten this life-saving vaccine, call them now. Work with them to get their shots this week or next. Pick them up, drive them. It can be your parents, your grandparents, your aunt, uncle, your neighbors. And finally, even after we open up vaccinations to all adults and put a site within 5 miles of 90% of the public, we know there are many people who still struggle to get access to a shot. We know that there are a number of seniors and people with disabilities and people in many communities of color who may be isolated and lack access to transportation. That's why we're ramping up transportation to vaccination centers and deploying more mobile units and pop-up clinics in the places close to where people live. That's why we're working with faith-based organizations and other community groups to host vaccination clinics, sign people up for appointments, get help them get those appointments. That's why we're sending even more vaccines to community health centers like the one I was at today, that altogether serve nearly 30 million Americans, like the ones I visited today. 2/3 of the patients at community health centers live at or below the poverty level. 60% are racial and ethnic minorities. To reach them, we're investing nearly $10 billion to expand testing, treatment, and vaccinations for the hardest hit, yet most underserved communities. Let me close with this. We've vaccinated more people than any other nation on earth. The vaccines have proven to be safe and effective. That should give us real hope. But we can't let it make us complacent. Despite the progress we're making as a nation, I want every American to know in no uncertain terms that this fight isn't over. This progress we've worked so hard to achieve can be reversed. Now's not the time to let down.